Hi, Logan.
Hi. A week later, the doctor removes the bandages. Here's the before and the after.
Is it ever okay for children to get cosmetic surgery? Well, we're going to dive deep into this topic by following 3 different stories of young people who go under the knife. How okay is it? There are plastic surgeons and parents who have differing opinions. Let's find out what yours is.
California teen Elise Chaddock was starting her sophomore year of high school and wasn't looking forward to it. She said she'd been bothered by bullies because of her nose.
She is a beautiful young woman. You can see she has a little bit of a bump on her nose. As a parent of 2 high school children, to think about this young, beautiful woman getting treated that way, getting bullied and made fun of, it really, really gets at me.
I don't like bullies.
Elise said she'd been dealing with the name calling for several years.
It's just like I want to hide or I just want to put my head down.
It is such a hard time when you are in middle school and high school and you're going through changes in your body and other kids aren't quite as understanding and sympathetic to you as they should be. And you add on top of that there is a potential solution to her issue, which is going under the knife, which is no fun, creates a pretty complicated scenario.
I see a bump on my nose and I see a bulge here.
Her nasal anatomy can be very natural. There are people who have bumps on their noses and they have children and their children get bumps on their noses. We can inherit this type of thing. But it's also something that can be acquired. You know, you can break your nose by a ball hitting your nose or by getting in an accident.
Ow! You broke my nose!
The treatment for that is a rhinoplasty or a nose job. But a big question that we need to answer is plastic surgery a remedy for bullying?
These kids are constantly being teased and you know, you want to do something for.
Now, this is her plastic surgeon, and I don't know him, but I do have to give him credit because he is planning to perform this operation for her pro bono. And apparently he has a foundation that can help people who are, let's say, are being bullied for things like this and can help them get cosmetic surgery as a way to help them get out of it.
Thank you!
Now, I'm going to share more about my thoughts on plastic surgery as a remedy to bullying a little bit later in this video.
Dr. Nicole began by giving Elise a chin implant.
So her main issue is she doesn't like her nose, but why would he put a chin implant in her? Well, I do a lot of chin implants, and these are solid silicone implants that are basically placed over the bone of the chin. And unlike breast implants, chin implants are made to basically stay there forever. Now, the appearance of the chin can definitely impact the perceived appearance of the nose. So when somebody has a chin that's relatively small, we call it microgenia, that can actually make the nose look bigger. And I have had patients in the past where they have come to see me to get a nose job. I take one look at them, I put a chin implant in them instead, and they're really happy with their appearance, having never changed their nose.
Then he worked on her nose. He straightened the bridge and made the tip of the nose more delicate. It took just over 2 hours to perform.
That's a pretty standard amount of time for a basic rhinoplasty where you shave the bump down, you take a little bit of cartilage out of the tip. When I did a lot of rhinoplasties earlier on in my career, this is pretty much what I would do for the vast majority of my patients.
Gosh.
Polished.
Here's Elise's before, and here she is after the surgery. The teen loved the results.
Now, this is a great early result, as you can see, but her nose definitely is swollen, and where you see the most swelling, and we'll show you the after picture right up here, is right there at the bridge of the nose. This part of the nose can stick out with the swelling, and that does tend to settle down with time.
I've seen such a dramatic change on her. She's just a much happier girl.
I feel super confident and I feel comfortable in my own skin.
Well, he did a fantastic job. It's nice to see her so happy. But the question then is it appropriate to perform a chin implant and a nose job on somebody who is a sophomore in high school, which we would guess then would be maybe 15 years old? Now, this in plastic surgery in general is a bit of a gray area. There are some plastic surgeons who do perform rhinoplasty on minors. It is not my thing.
That is not my job.
Yeah, that was my catchphrase.
That is not my job.
You
don't do it right.
It's not something I ever did in my practice. I wouldn't judge anybody necessarily for doing it, but as a plastic surgeon, unless it was a really, really extreme case, like let's say somebody who had their nose broken and they had a lot of deformity after, let's say, a majorly broken nose, I don't know that this is something that I myself would have performed.
Arandini Valencia wanted a change before she started college.
I don't feel confident.
The California teen wished to change her breast cup size.
So it looks like we've got a beautiful young woman who is between high school and college, so she's probably 17, 18, and she wants a breast augmentation. Is that ethically appropriate?
For years, Arandini says she's been asking her mom, Monica, for breast implants. Mom finally relented.
So why does she have to ask her mom for breast implants? Well, there are a lot of potential reasons. If she is under 18, then to get a medical procedure like this, you do need to have your parent sign your consent form for you. So it's possible if she's under 18 that her mother needs to sign for her, otherwise she literally just can't get it done. Obviously, another reason why her mother has to approve of it is because maybe she's going to take care of her, or maybe she's going to pay for it, or both. Are you like the millions of people who have a bathroom filled with half-empty bottles and tubes of skincare? They may have promised to reduce your wrinkles, lighten your blemishes, and help you feel better about your skin, but none of them actually worked. Well, I've got the answer for you. It's called Youn Beauty. Youn Beauty is one of the only skincare lines that combines natural and organic ingredients with the latest and scientifically proven components like vitamin C and retinol. I'm so certain that you'll love Youn Beauty products that we offer a 30-day money-back guarantee, no questions asked. Head to younbeauty.com and use the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below. Once you try Youn Beauty products, I bet you'll throw away your other skincare products and start loving your skin again. Thank you for putting your trust in me.
As long as she understands everything and everything is explained to her, it's totally safe. I prefer them to be 18 years old or older.
So there's a lot in what he said I think that's so important. Number one, when I do breast augmentations on younger women, and I don't do it on anybody under 18 unless it's some type of anatomic abnormality, the first thing is that that patient really has to have a good understanding of what they're getting themselves into. Breast augmentation is a surgery that is going to necessitate many more operations over a lifetime. Implants are not meant to last forever, and I tell my patients that you need to consider switching them out a minimum of every 15 to 20 years. So there is a question of whether somebody who, let's say, is 17 years old has a good grasp and an understanding of that. Well, the second statement is that he prefers his patients to be over 18. Unfortunately, there are a lot of young women, tens of thousands, who get breast augmentation before they turn 18 as a cosmetic operation. Once again, it's not something that I do, but it is something that is being performed all throughout the country.
A kiss from mom and she's off to the OR. The procedure takes an hour.
Amazing.
That is pretty quick. Most breast augmentations that I do take about an hour and a half, but some doctors do it in as little as an hour, and I'm glad that hers appears to have gone very smoothly.
And a month later, it's clothes shopping time.
You look beautiful. Thank you.
Arandini said she was now looking forward to college.
I feel really good, really happy.
Well, she looks fantastic. He did a nice job, it looks like, and it's so great to see her so happy with her result. So is this something myself that I would feel comfortable performing? Well, if she was over 18, once again, this is something I would consider after a lot of discussion and making sure that this is definitely the right thing for her. Anybody under 18 in a cosmetic fashion like this, it's not my deal. I wouldn't do it.
That is not my job.
Yeah, that was my catchphrase.
That is not my job.
You don't do it right.
And here's a story of an almost teen. When Logan Hanna was 12, he didn't like his ears. He was picked on at school and called cruel names.
So let's get into it. Is plastic surgery a reasonable treatment for bullying? If you have a child who's being bullied, is it reasonable to have plastic surgery on that child so that that bullying will cease? Now, my feeling with this is very simple. What needs to change is not the anatomy of the person being bullied. What needs to change is the behavior of the people who are bullying this child. Period.
You are so right. You are so right.
So Logan and his parents visited a Dallas plastic surgeon who specialized in autoplasty. It's a procedure that pins back the ears.
Otoplasty or ear pinback surgery is a pretty common operation. It's usually performed on younger people like Logan. He's 12 years old. I have performed it quite often on older people too, adults who just never did anything with their ears until they got older.
Temporary deafness in one ear. It was both ears.
This is an operation where we make an incision behind the ear and we either suture back the cartilage or remove portions of the cartilage to set the ears backward. Now, when you're 7 years old, the ear has reached about 70% of its adult size. When you're 9 years old, it's reached about 90% of the adult size. So typically in plastic surgery, it's believed that any time after the age of about 7 to 9 would be a reasonable time to perform otoplasty surgery.
After a hug from his parents, Logan is ready to go. It takes 2 hours under general anesthesia.
One of the big issues that I have with performing this operation on children is that there are risks associated with it. Risks that a child may not quite understand. The biggest thing I worry about with otoplasty is infection. If the cartilage of the ear gets infected, it can be an absolute disaster. The ear cartilage can literally melt away and the ear itself can completely deform.
That's not good, is it?
And that's where, for me, it kind of bothers me. When you have a child who's getting bullied by another child, and in order to stop the bullying, you put the child who's being bullied under an operation with the potential risk of complications, well, what's happening to the person who's bullying this child? That's what really needs to change from the beginning, not necessarily the appearance of the child himself or herself.
Hey, Logan.
Hi. A week later, the doctor removes the bandages. Here's the before and the after.
I look good.
Great looking kid, and I think it is important to realize that this is not something I would at all judge the parents for having their child have this done. I mean, as the parent of children myself, I feel for them because that's really the worst feeling, is when you have a child who's having a hard time. I would not judge them whatsoever for having their child undergo this procedure.
Hey, I'm not judging.
So the question with a lot of these children is, are they having the plastic surgery too soon? Well, sometimes that's the question, but sometimes the question is the opposite of why did you wait so long to get something like this done? And there is a story that will blow your mind from Dr. Pimple Popper of a gentleman who had a little thing on his nose that eventually grew to be the size of a football. Imagine a football hanging from the end of your nose, and why would you not get rid of it earlier? Well, take a peek at this video right up here where I react to an episode of Dr. Pimple Popper with the absolute worst case of nose rhinophyma as you will ever see. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.